First thing we will do is approval of minutes of the August 19th, 2021 meeting. The information's in your packet. Any questions, concerns? Otherwise, I'll take a motion to accept.
I'll make a motion to accept the minutes.
Thank you. Second?
I wasn't at that meeting, so I can't really say.
Deb, were you at that meeting that you can second?
Yeah.
Okay, thank you. Okay, with a motion and a second, all in favor say aye.
Aye.
And that passes unanimously. Then number 3 is discussion and possible action on Transit Development Program, TDP, introduction of project team from RLS and Associates, and project update.
Well, I'll start it off.
You have to get in the microphone.
I'll start it off by saying that.
Still hard to hear.
Okay.
There it is, okay.
I'll start it off by saying that the Wausau Metropolitan Planning Organization has engaged a consultant, RLS Associates, to conduct our 5-year plan. They have kicked off the project this week and have been in town, and we have representatives here today. I'm going to kick it over to Andy to kind of introduce the project a little bit and introduce our consultants, and they can make a presentation for us.
Okay. Andrew Lynch, Transportation Planner for the Wausa Metropolitan Planning Organization. And as Greg pointed out, this is our plan. We're the planning arm for the local transit provider. And every 5 years we do a TDP, or Transit Development Program. I'm sure you probably remember this conversation from previous meetings, but the opportunity came up to do this plan a year earlier, and we've received federal funding for this as well. And through a process, we hired RLS Associates out of Ohio. And I believe they have a presentation to kind of update on where we are, and I'm just going to let them. We have Nathan Bubash and Steve Yaffe who are going to talk about that. So take it away.
There we go. So, thank you, Andrew. So my name's Nathan Bubash with RLS and Associates. We are based in Dayton, Ohio. We do basically public transit planning, a lot of small systems that we work with, rural systems. So this is kind of our bread and butter, working with transit agencies like this. So we were very happy to have the opportunity to come out here, work with MPO, work with Metro Ride, and be here in Wausau this whole week. I'm just going to kind of go through what we're planning on doing, what we've been doing this week, and just kind of the next steps for the project. So also with me, sitting right over there, is Steve Yaffe. He will be talking a little bit later in the presentation as well. So first, I just want to go over a timeline of where we're at. Hopefully everyone can see that fairly well. So the first thing that we started out doing when we started this project is just looking at the existing conditions, what's going on in Wausau, how the transit system is set up, and who it's providing service to, and that kind of led us to providing surveys and handing out, doing the ridership survey and getting local input from both the riders and then a public survey that's going to come a little bit later in this year. Then that will lead us to an evaluation of the service that Metro Ride provides. That will be looking at the different stops, basically evaluating all of the stops, evaluating all of the routes, figuring out if what they're doing is if it's the most efficient way to do it, if there could be improvements, if what they're doing, maybe it is the best way to do it. We're not sure, so that's going to be a major portion of this plan, and that will lead us to the next part of figuring out what options there are for improvement. And that will stem from the evaluation, it'll stem from input that we get from the surveys and from local input. And throughout all of that will be a major part, and this is a very big part, and that's what Steve has in this project, as a small part they has in this project, but very important, is figuring out different types of technology that Metro Ride could really benefit from and really helping revamp or provide better service to Wausau and potentially the metro area. And then the final part will be coming up with a draft plan that will be the TDP, our ultimate recommendations, and then the final plan. So we're looking at roughly a 1-year timeline. There's always a little bit of leeway in that, depending on who knows what may happen. There could be delays. We could get done early. But that is our general timeline as of right now. And right now, we are in the existing conditions, we're reviewing existing conditions and getting surveys and local input. And just to kind of give you a brief look at what we were looking at as far as existing conditions, we were looking at the prior reports, the prior TDPs that have been done. We're looking at Metro Ride policies, as I had mentioned, looking at the current routes and stops, major trip destinations throughout not only Wausau, but also just the metro area in general. Looking at demographic data to see, like, where are the large pockets of the seniors in the area? Where are the large pockets of disabled people or low-income people? It's always really good information to know. And then along the same vein, socioeconomic data. Where are people who live in poverty or who also maybe require food stamps or things along those lines. And just for a little bit of background, I know most of you probably have a general idea about this information, but Metro Ride has seen a decline in ridership over the past 10 years. And this is not necessarily anything new in the transit industry as a whole. Some of the lines that are marked on there show some major points in time. The first one, 2012, is when there's the major service reduction that pretty much brought all the routes back into just the city of Wausau and no longer provided service outside of the city. Then in 2015, there was a limited service that was eliminated, which was the previous Route K. And then the more obvious one in 2020, the pandemic started, and industry-wide, there was a huge drop in ridership as well. So what we've been doing this past week, we've been collecting rider surveys. I've been going back and forth to the transit garage starting at 6 a.m. and ending at 6:30 p.m. getting surveyors on and off the buses and getting ridership counts throughout the entire day. And I have just an example, I know it's kind of hard to read, but that's just an example of, well, it is a copy of the survey that we're providing. So we were asking demographic questions. We were asking mainly, like, what do you think about the transit service, about Metro Ride? Where do you go when you ride the bus? Where are you coming from? How many days a week do you serve or do you ride? And then just for some other general comments as well. And then with surveys, this will also lead to a public survey that will be starting hopefully next month and running into December as well. And then we'll be doing employer surveys of major employers throughout the metropolitan area as well. So also, as part of us being here for the surveys, since we're here in town, we've also been conducting interviews and meetings with potential stakeholders throughout the area. We've had meetings with Metro Ride staff, drivers, elected officials, various employers, people in the medical community, and human service agencies. Then also we had 2 public meetings yesterday. I believe some of you were attended. We were able to speak to a handful of people, get some great feedback on what they believe Metro Ride did well, what they think might be great to do in the future. And it will help us lead to building a project oversight committee as well, which will be one of our next steps that I'll go over in a minute. And I just wanted to provide some brief points of some of the feedback that we received mainly yesterday and that we've heard over the past few days as well. One of the main things is that people believe it's important and necessary to educate the public on the benefits of transit, because some people think that not everyone knows about the transit in Wausau, or they just maybe don't understand to what extent it is used or what it can actually do. There's also a suggestion on providing or putting in effect a return on investment study for public transit in the metropolitan area. And then people also think it's important to get stakeholder input and buy-in early within this planning process to ensure the likelihood of this plan actually being implemented when it's finished, to ensure that actually increases.
Let's take this opportunity to delve into this a little more. Is it working? Let's take this opportunity to delve into what is transit, what is mobility, who are our customers. So when we assess return on investment, investment in what? It could be a fixed route bus, and there's a need here to continue fixed route bus. It could be some of the newer demand response services. It could be as a combination, which in many towns have been focused on older adults, people with disabilities, low-income residents, but in many places it's general public, serving everybody in a neighborhood, especially lower density neighborhoods where a fixed route, there's not enough density to support a fixed route to bring them to a transfer point. So, and the return, what does the return investment areas work in? Enabling people to get to and from work so they can improve their economic status. And that's been measured nationally by the American Public Transit Association. It's getting people to health care and social determinants of health. Often the doctor tells you, you gotta start eating better, vegetables, not available at the dollar store, which means you have to get to the grocery store for fresh produce. Maybe part of an exercise program, might have to go to the Y. What a great Y you have here. And you can, and often hospital systems, managed care, Medicare Advantage find it cheaper to pay for the ride, not even charging a fare, because they save money by not wasting physician time, not wasting equipment time such as MRI machines. I mean, I've seen no-show rates for medical appointments as high as 17%. So when we're talking return on investment, the investment could be taxpayer money, could be the usual funding sources, could be partner contributions from employers through the IRS commuter benefits, for example, or from healthcare. So that they become stakeholders. Your neighborhood leaders, your community-based organizations are stakeholders. You, of course, are stakeholders. Folks who ride the bus become stakeholders. To prepare a concise package with concise, I like bullet points, that tell the story. And it's an ongoing effort. And we hope to give you the basis for that ongoing effort to build support. Back to you.
All right, so one of the last points that I wanted to mention from input that we received yesterday is that one of the challenges that it seems like people see especially when it comes to expanding service outside the Wausau area, is that gaining support of political will and potential partners, and especially funding from these potential organizations, has the potential to be very difficult, and something that we will need to keep in mind as we are looking at potential recommendations or solutions to any recommendations that we may be making. And this is something that we've found out that is not necessarily just a local issue, but also something at a more regional and statewide level as well. And so just kind of a brief look, we had heard about service extensions into Rib Mountain, the DMV in Rib Mountain, other shopping, medical care, and employment areas, going into Weston, to low-income populations, industrial areas, healthcare, going into Rothschild, Schofield, and then just the potential for possibly redefining transit in Wausau in general. So with that being what we had just done, kind of our next step will be creating 3 to 5 stakeholder interest groups. And we're looking at having employers and or business community members being one of those focus groups, another being riders and potential riders, and then also having community stakeholders that we will be identifying through working with MPO, working with Metro Ride, and then also working with you guys as the Transit Commission, because we're going to want your input throughout this process as well, to make sure you guys are kept in the loop and that we are making sure that you are involved and not just kind of kept in the dark until we're done. So we're going to want to make sure that if you guys believe that there are certain stakeholders that you want to have in these focus groups or something, we want to make sure that you have the possibility to be heard throughout this and contribute to this planning process as well. Our next part of this will be service evaluation, as I had mentioned. So we'll be connecting desired needs of travel, and also looking at just like what Metro Ride has available to them, and also updating the goals and objectives that Metro Ride had from the previous TDP, but also looking at current situations and the current challenges that they're facing now that may not have been a problem during their last planning process. And then also establishing new performance measures to figure out, is there a set number of riders that they may want to get through, or set run times or things along those lines that will be something, goals to meet to help keep this plan relevant and ongoing. Steve, would you like to start?
So we're looking at the route structure as well as individual routes, the timetables, the span of service. Does MetroRide start early enough to get people to first shift jobs, which I'm hearing often in the industrial areas starts at 6 a.m.? Does it take them, will it serve the second shift, both getting them there and getting them back? Right now it does not, because the second shift usually ends after 10 o'clock. Does it connect people to places? What places? Healthcare, we do service Virus, not the big Marshfield Clinic in Weston, no. Do we serve workplaces? Less so than in the past. Can people get to an affordable grocery store? Because a lot of the riders are income constrained, and while they might like to shop at high-end stores, their budget is more geared towards Target or Walmart. But can they get to Target or Walmart? Not right now. So what other priorities? We heard quite a bit about that, especially. Technology. We're in a state of revolution in transit with new technologies, where a bus can have, with data communications, which you currently don't have, can show where the bus is on its route. If you punch in your bus stop by number, you can see on an app in other cities how many minutes the bus is away, or if you have two routes serving the same stop individually for each route. You, with data communications, could set up an account-based payment system allowing one to pay with a cell phone using a QR code. QR readers are very inexpensive. There's fare, rather than shelling out front the money for a monthly pass, with that type of technology, you could do it. The term is called fare capping. I'm not sure how that came about, but if you ride 20 times whatever number you set during the month, the rest of the month could be free because you've already paid the cost of the monthly pass, one ride at a time. Passenger counters. A lot of buses have automated passenger counters where you walk across an infrared beam that you can't even see or feel, and it counts. Maintenance, you have a good maintenance software package already. Reporting, it can be automated if you have data communications to make that process a lot easier. There's just a lot of opportunities that can be obtained through federal grants, which are on an 80-20 basis. Not hard to get that 20% local match. To create a new system that's attractive, but the trick is to find operating money so that the span of service is adequate and the coverage is adequate to meet the needs of your riders and to attract more people who we call choice riders would choose to ride the bus so that they can work on their iPhones, get some work done on the way to work or whatever they want to be doing. So this transit development plan is going to go a little further than what you've seen in the past. But the trick is how to explain it and how to pay for it. Did you want to cover this slide?
Yeah, sure. Just kind of going into a little depth of what Steve was just saying. We're going to be looking into having this plan being very, very detailed into the recommendations that we are providing, while also providing potential ways to fund it or just to keep these recommendations going moving forward, so that this plan isn't something like a lot of planning projects can be, that it's just not set on a shelf. and just left there until this is required to be done 5 years down the road. And that would be especially important with like the financial plan, because funding is always a problem when it comes to these sorts of things, where you could be asking for huge, huge changes that require a lot of money, and providing these recommendations that have the possibility to, like, here's funding source A, B, and C, you can tap into this, or possibly get assistance from these people. So we're going to be looking to provide as much help and as much information as we can, and as we're able to find, to hopefully make this something that that you guys can use moving forward and long-term to provide better transit and help to the area.
One more thing to stress is that members of the team have operating experience, both in fixed route transit, bus transit, and demand response. We won't recommend something that's not achievable. And we'll show how to get there and how technology can support that. Because we know the people of Wausau will need mobility. Everybody needs mobility, needs to be able to reach destinations. We also have experience with, I'm a Easter Seals contractor for the National Aging and Disability Transportation Center, for example. We have a disability perspective. I know the RLS team has worked with, and I to an extent have worked in the area of mobility management, which is a capital expense item for the federal government for that 80-20 match. A mobility manager matches people who need rides with resources that can provide rides and resources that can help pay for the ride. From the human service transportation point of view, one mixes and funding sources, whether it's Department of Labor to get to and from work, or Health and Human Services, which is paying for refugee resettlement, often also focus on getting them to and from work. We can discuss a mix of funding sources, but again, it's got to be an ongoing effort beyond the TDP to get the recommendations implemented. And having a mobility manager, in Wisconsin, is a leader in mobility management. They have a statewide mobility manager association with a lot of creative approaches across the state, but you don't have one here. And it would be helpful to have that individual work to create and maintain partnerships to support mobility, of which transit's the shining light.
All right, the very last thing that I wanted to point out is what we will be doing after this step of getting the rider surveys and then also looking at the existing conditions. So the rider survey is finishing up in about an hour and a half. So after that, we will be working on the public survey, and then also getting together with Steve and also figuring out some of the technology recommendations that will be ongoing through a lot of this process of figuring out what's going to work best. And then also as part of the local input phase of this, we will also be starting up the figuring out the focus groups and getting ready to put those together and plan the actual meetings with them. So that's pretty much where we are and what we're going to be doing as our next step. So that is all I have. If we have time for questions potentially, Steve and I are willing to answer any questions you may have. So thank you for your time and letting me present.
Much appreciated.
I do have a quick question for you, Nathan.
Mm-hmm.
Have you talked to the job service of Wisconsin here in Marathon County at all?
I I don't think, we haven't yet. I believe they are on our list of people to contact,
Great.
but we did not while we were here. We pretty much got as many people as we could while we were here for the short week. But they will definitely be on our list to contact if they aren't already.
Great.
Another possibility you should check into is Goodwill and job coaches and employment agencies.
I actually just talked to Goodwill today.
But there's like job coaches at the healthcare center and different agencies and adaptive community. There's a lot of special programs.
Okay, thank you.
I was going to say, for Jen and I, we are new to the commission in our first term, and I guess I have lived in both metropolitan areas and rural areas and grew up in the UP. So I don't know if you have this perspective or not, but in my opinion, we do have a lot of employers in our area that are expecting you have a car, that you can get there. Now, you may have not toured much about the Wausa area, but it is very hilly, and when it gets to be winter, it can be very icy, and that can limit even those that may not have visible disabilities to get around in order to get to the different stops. And then a lot of the sidewalks are not shoveled, and then the stops are not even shoveled out so that you know where to stand one way or the other. We have very few shelters. But I guess for myself, I have, for the majority of my life, had a vehicle. Until at a certain point back in the 80s when I lived in Chicago, where it was a handicap, and that it was, Chicago is very connected with transportation, and it really makes sense to use it. But there is a number of people in the community, as well as employers, that basically just expect you are going to have ride, and you're going to have a car that's in good order to be able to work whatever shift. And for myself, I'm used to being able to drive, and okay, I don't mind driving an hour just for a drive. But we do have a community of a number of people with disabilities. I don't know if you have talked to the North Central Technical College, but they are the premier, in my opinion, college that woos people with disabilities here because of their program of both visual and hearing impaired. And because they've had such a good reputation for decades, they have different companies that will test their equipment here before they sell it. And that there are a number of places off of Campus Drive that do seem to house some people with disabilities, but they're being able to get out and about any day they want after 6 o'clock, wanting to do whatever in the evening or on the weekend. We don't have that capability. And that for some people, they feel that if you don't have a car, that you might be the lowest of the income or homeless or have some major issues, so that they really look at it, some people do, with disdain of people that are using the bus. For myself, I used it in Chicago quite a bit, and then over the last few years, I had some car problems, and my mechanic was out in Weston, and when they still had the Weston route, I got off at County Road X and would walk 1.5 miles to go and pick up my car. I had ridden with other people that were from that area in Weston, that had Green Acres, where a lot of them enjoyed coming into Wausau because they could go downtown and enjoy the fountain and do a lot of things that were free and having a number of different events. But with the loss of that outside the city limits, there is a large population that is not being served. And some of the residents feel that it's only a Wausau problem and that they don't care about it. I happened to attend with some other people about 2 years ago, a meeting at Weston to talk about TIF and about issues in Weston. And they were saying that they were trying to woo more people that are from other countries to help with their labor shortages. And they're assuming that some of them will be people that don't have transportation, or maybe they're expecting it's going to take longer, and that transportation may not be something that they can get within a short period of time, or maybe a year. So they were talking about how are they going to get those kind of things. So we are one of the biggest towns in the area, but we're in an area that is considered pretty rural. So we have this kind of dilemma that some people really look at it with not very good perspective, and I have used it at times, and I have found that I do feel that we need things better. I also am a healthcare power of attorney for a neighbor of mine that's had major health issues in the last 2 years. Recently had a stroke the end of June. And I met her at her clinic on Friday, which the bus does not serve on the west side. And after her appointment and notifying the taxi, it was over an hour and a half, where they had said they would be there for 40 minutes. And it ended up, we were there till 4:30 when the office closed at 4. And my neighbor's 84 and frail. And a couple of the staff had offered to put her in my car, which she has ridden in past years before her stroke. And she was already in my car when the taxi showed up extremely late. So I do think that we are kind of stuck with just one taxi that seems to be the lowest, but has a very long waiting period, and that there should be some other options so that people that are needing doctor's appointments should be able to get there without, and this was on a Friday, where they were about ready to close the door and they were waiting for us to get out of the clinic. So I guess I also have some concerns because of my interest in this area, that I had heard from one of the disabled riders who informed me on my personal email yesterday about your Zoom session, and it was not on the city calendar. And in talking to your office in Ohio, they said that it was the responsibility of Metro Ride to do the media. And I had emailed Greg about this. And my concern is, I would have loved to have been a part of this and give other perspectives and also hear what other people are saying. But I also want to feel that I can be candid with these other issues where other people may not tell you this about our community, and if you don't have a car and vehicle, that you're being, in my opinion, being treated differently and poorly. I do think we need more bus lines and looking at how we can serve people better, but we're in a a year-round, four-season climate where, we've had a few snowflakes already. Temperatures can get down to 25 below. And it just seems that we don't have a good place for people to be. And now with the mall bathrooms gone, we don't have a place for riders in order to use restrooms either, or a place to warm up if they're getting cold. So I do feel that you need to know some of these issues, and that I do feel that people deserve better than what we have. But also, I don't recall seeing these numbers of how low we've gone from over 8 to 900,000. And then I realized with those numbers, that's probably daily duplication. And so how many are we actually serving on a monthly basis by passes and that? And that we seem to be very dependent on the school system. So if the school system ends up pulling out at some point, can we continue on? So I do feel that we had no paper copy of this presentation. I would like to see a written copy of the information, and that you had said you talked to different officials, but I don't know who you talked to. I was not aware of the meeting yesterday, and then I had a city meeting at 5:15, so I couldn't stay for the other hour, and then you seem to have some audio issues. But for other people that are on fixed incomes or people that are savvy with their money, I'm a big believer in my home phone, and I use a track phone for emergencies. I have limited, I don't even have any text or data on it. I just use it as an emergency phone. A lot of people that are on fixed incomes that may be on food stamps and such, they may be eligible for a track phone, but it's mainly limited minutes and not for the other technology. I do agree that there's times that we are really almost in the dinosaur area with transit compared to other communities, and that at times I have noticed while riding a few times on my own where the different routes and stops are not being announced. And if you're somebody new that is not exactly sure where you're going, this is kind of critical information. And I'm hoping as part of what we find out and different training, that we somehow end up has sensitivity training where staff and maybe the commission as well will participate in having some disabilities to see it from a different point of view. My mom ended up being a stroke survivor and being in a wheelchair for 10 years in her 80s and 90. So I feel like I have a better grasp of some of that, but it's another thing to be seeing it daily of people with other disabilities and what they're dealing with. And that other volunteers have started a community outreach on Facebook of people offering to shovel different corners or sidewalks, because there are people with disabilities that the sidewalks are not getting plowed, and people in their scooters or vets are going on Bridge Street on the road in order to get across the bridge and do their shopping. So I do feel you have a very large job on how to deal with a lot of these issues, and then we have no control over the weather. And then with staffing shortages, we're expecting that that plowing for snow this winter is going to take longer, and I think keep other people with disabilities stuck at home, unfortunately. But that we do need to really look at some major improvements. I am retired and I'm willing to be involved in some of these other discussions, that I do feel that we need to hear more of it, even just being silent in the background from employers. But that a lot of the employers in the area just don't seem to want to care about having transit in their area. They seem to have a negative viewpoint of it. And I'm hoping through your analysis and talking, that may not be prevalent, but I do feel that you should be aware that there could be that undertone, and I do feel that we need to be candid about it, and that hopefully in the long term, we can educate people. And I'm a baby boomer, and I feel that at some point in time, I may want to give up my car, but I also want to see a transit that is going to be a lot better than what we have. Thank you.
A lot of your points hit on education, the need for education, and you're absolutely right. People need to know why mobility is necessary, the economic impacts of lack of mobility, both on businesses and employers, as well as the individuals, and disability sensitivity. There's some best practices that have been applied elsewhere that should be applied everywhere for every transit system. And we've been discussing that as well. But I expect that out of our work product, you'll have some succinct key points to spread. And then again, I mentioned the mobility manager idea, to have a focused person to help disseminate those key points, to turn that tide, to build that conversation the way it needs to be built. So, yeah, I'm with you. Understood.
And I think that, I think it needs to be said in the public that that Zoom meeting is not the only interaction. That's very small. They're going to get whips involved with focus groups, with all the stakeholders in our community, and that includes Weston. I know that they were involved. I think Rothschild was involved. So they are getting everybody together. This is not like a quick, have a quick couple of Zoom meetings and it's over. So this has just started. We are, it will be delved into pretty substantially. And the stakeholders that you were talking about are going to be invited. And like I said, there's some local people in WIPs who are used to getting these stakeholders together, and I think there'll be some good discussions. Greg, I'd like you to bring up about this meeting. I'd like you publicly to say that, how these meetings are to be noticed to the public.
Sure. Just to be clear, this was not a meeting of a public body. This was not a meeting that Metro Ride organized or promoted. This is a meeting arranged by the Metropolitan Planning Organization, and it was conducted by the consultants. So this was a consultant meeting. I was in attendance for those meetings as staff, but we didn't organize them. That's what we hired the consultant to do. And so it didn't appear on the calendar because I didn't organize it, I didn't sponsor it. It was not a City of Wausa or a Metro Ride meeting. So that's the whole scoop.
And as with every meeting, including the ones that RLS organizes, there's always in the bottom a little sentence: if you need alternative formats or translation, please let us know so we can arrange for it.
Which you did, because I called about large print surveys and it was provided.
Any other questions for our consultants?
No, just thank you for the work that you're doing. That sounds really great.
Pleasure meeting you. Referrals are wonderful, and I appreciate the ones that you gave us as far as talking to folks. They really do help.
I have a question. Is there any possibility that we can see the list of who you contacted so we might think of some other people that you might have not contacted?
Yes, of course, we'll be able to, I think the easiest way is probably to provide that to Greg, and he will be able to distribute that to you guys as a whole.
That would be greatly appreciated.
Okay, thanks.
Thank you.
Thank you so much for your time.
And we can get you a copy of the presentation from today as well.
Yep, sounds good. Thank you. Okay, moving on, excuse me. Discussion and possible action on financial report and budget.
Okay, there are a couple pieces of financial information in your packet. The first is a single pager, which is the revenue and expense summary. And this is for the period ended August 31st, 2021. There are a few line items on here that I would like to draw your attention to if you've not noticed them already, because they stand out for me. About halfway down, the maintenance grounds and equipment. We had some extraordinary things go on in 2021. One is furnace replacement that actually ended up in this account, and it shouldn't. It was about a $4,000 item, so that will come out. I discovered that today. But the other big thing was the replacement of our door locks. We spent nearly $10,000 rekeying our building. I had mentioned in previous buildings that our swipe card system failed. It hasn't been functional for about 3 years now. And over time, we've had to go back to a keyed building. And unfortunately, there are more keys floating around than we could keep track of. And so we started to notice things moved in offices and that sort of thing, and we became concerned about security. And so we have replaced all of the keyed entry in the building, in our main facility, through a local company. So that was not something I had planned for, and so that has ballooned that line item. In terms of a little further down, the postage, duplication, office supplies, that's kind of a broad category, but the real driver there is printing. So we reprinted our route maps and schedules in their entirety, but the real driver of expense was we hired a graphic designer for about $7,500. That's not something we normally do. We've relied traditionally on the designer at the printing company, and we wanted to completely redesign, and so we hired his services, and we're glad we did. But we also, for the first time, did some translation. We've paid for both Hmong and Spanish translation. We are going to print the Hmong map. That's in process, but we are not, through Title VI, required to print Spanish because the population isn't significant enough, but we're printing it digitally, and it will be posted on our line as an alternative. The third one that sticks out for me is the other expenses. One of the things we have in that other account is when we buy, for instance, a transmission, we'll buy a rebuilt engine, we get what's called a core charge. In this case, it's about $4,000. And then when we return the old unit that we've replaced, they send us a check to back that out. And apparently we've not handled that from accounting perspective to zero out those transactions. So that's why we're way over on that line item. And the last line item I would point out is further toward the bottom, advertising. During the pandemic, we had a number of advertisers that went in arrears. We were unable to collect, and we worked with our advertising vendor to delay the receipt of those revenues. And so we've recovered some of that, and advertising, it appears, has recovered as well as we come out of the pandemic. I budgeted less, not really knowing, and I'm pleased to report that it has bounced back a little bit. So those are the line items I thought I would further explain for you. Are there any questions?
I love the new bus map. It's easy to explain the people that haven't rode the bus. I really like it. And was the advertising budget part of the yard signs to try to get drivers?
That's part of our printing budget. so-
That's
so-
printing?
yeah,
Okay.
Yeah. So, any other questions?
Okay. Seeing none, discussion and possible action.
Oh, the other part is the budget.
Oh, okay, sorry.
And so there's a second, a 3-pager. And I'm going to right off the bat replace one of the exhibits that I found an error this afternoon, unfortunately. So it's going to you. And I added a little bit to the exhibit, and I pulled the wrong number. Thank you, Ben. You're welcome. Okay, so the first page of the exhibit is a summary of my operating budget. So the first column is 2021, the projected of where we're going to land at the end of the year. This was a tough year to budget, and it's a tough year to project toward the end of the year, but this is my best effort. So I've worked with the finance department, Mary Ann, on how we can assist the city with the use of CARES funds. The purpose of the CARES funds is to assist financially with the city or the transit system to recover lost revenues, or to cover additional expense, or to assist with the overall financial condition of the city. And so what we've done here is we're applying CARES funds so that we can reduce the city's levy reliance for the transit system across 3 years. So if I could kind of explain how this works. So starting with gross expense, we have to apply certain funds we receive as a contra expense. It's not a revenue, it's a contra expense. And the reason the state wants us to do that is because normal operating assistance is doled out as a percentage of expense. So they can subtract all those other revenues out first. Their base number for funding us is smaller. We're subtracting 85,205, which is paratransit funding, CARES funds at $675,000, and then the state awarded us a portion of their ARPA funds to be used specifically for operating assistance. So that's what that line item is. Their goal was to bring up the amount of state and federal money combined by enhancing with ARPA funds. So that's the 125,475. And then we subtract our operating revenue, and that gives us the deficit. So federal operating assistance, which is federal 5307, cannot exceed 50% of your deficit. So that percentage number is my calculation of what that total is. So it's a little under 50%, and that's the total allocation they have set aside for us. And then I would draw your attention to the City of Wausa line item. There's a percentage there too. Our share has to be at least 20% of the amount we get from the state of Wisconsin. So the state of Wisconsin share is the state 85,205, which is 786,191. And then the 8521 line item, which is 44,759. So the city share is actually more than that. It's 31.57. So we're okay. The state had developed a formula last year, and that's basically the formula that we're using now to make sure that the amount of CARES money we draw down, gets us to where we want to be, and we don't draw too much. And so we've applied the CARES funds on all 3 years, as I've said. By drawing it down in 2021, it'll create a carryover, and I'll get to that in a minute. There are some things we're going to do with that. So in addition to drawing down the city's share and saving the city money, we're going to do some things with those, that carryover money. In 2022, the city of Wausa share goes up slightly. And then in 2023, we're going to draw less CARES money. And the city's share is going to go up, about double. But we're trying to transition back to what would be a normal levy amount for the city. So we're up to $891,000 in 2023. So that's the budget summary. Any questions about that budget summary? Okay, the second exhibit is federal stimulus funds. This kind of explains what the funds are, what they can be used for, how much there are, and then what we're proposing or what we've already used them for. So we've received two pots of money, two grants. The first one is the Coronavirus Aid Relief Economic Security Grant, which is CARES. The total award was a little over $3.2 million. And essentially, it can be used for almost anything, any expense incurred after January 20th of 2020. So the language in the bill says that it is assumed that any expense incurred after that date is in response to the coronavirus. So it's really anything, operating expenses or capital. There is no end date to exhaust the funds. And when I applied for the money, I asked for two things: operating assistance, which is the bulk of it, and then driver barriers, which we've already purchased. The second pot of money is the American Rescue Plan, or ARPA. The total assistance for that is really two separate amounts. I mentioned in the previous exhibit that $125,475. That the state program for us, they said that is for operating assistance. So that is how we'll use it. And then the second amount, the $1.15 million, that is undesignated at this point. I've not even applied for the money. We don't have to apply for the money until 2024. That's really the only date that's in the bill. Down below is a summary of both what we've done with the money in 2020 and then what we're planning to do based on the budget I just presented. So we were awarded the CARES funds, $3.2 million in 2020. We applied $850,000 toward operating assistance, and we bought driver barriers. In 2021, we're receiving ARPA funds, $1.27 million. We're proposing to use a little over $800,000 for operating assistance. And then I've got the operating assistance money that I've proposed in the previous exhibit for 2022 and 23. If you look to the end here, I've not programmed anything for 2024. I think it's a little early to decide. But you'll see that we have almost $1.5 million left to decide its purpose. One of the things, as we just saw from our previous presentation here, is technology. We've talked about technology previously. We talked about hiring a consultant to consider technology for us. Well, in the end, we rolled it into this 5-year plan, and so they will provide us some recommendations on technology, and I've been having that discussion with him. Any questions on that exhibit?
Greg?
Yes.
I'm not sure in regard to transit, but I had thought that for the American Rescue Plan, that it had to be spent within 3 years by December 31st 3 years from now. So is there any time limit as well on the transit?
No, my understanding, and I specifically asked the FTA rep a few weeks ago about that, and he said the only timeline set in the American Rescue Plan is when you have to obligate the funds, which is when you have to submit a grant application and have it awarded, and that's 2024. So we do have time. You're welcome.
Question, but maybe I'm looking at this wrong. How much money is spent on masks for the students and people that ride the bus since the schools opened? Has that gone up in your budget?
Actually, no. So we received a shipment of masks for both our employees and the general public, if we want, from the Federal Transit Administration. And that came actually from the CDC. They funneled it to us. Those were the white cloth masks. And since then, we've been getting masks through emergency government, Marathon County Emergency Government, and those are the paper masks. So whenever we run low, we ask for another pallet. And so we have been enforcing the CDC's mandate on masks on the bus, and we've been offering masks to anyone who says, I don't have one. So that's where we're getting.
Because I have a question.
Sure.
Technically, the transit center is transit, correct? People should be wearing them there? Am I correct?
I'd rather not say in a public meeting.
Okay.
I don't want to admit this, but technically the transit center is now not required to have masks,
Oh.
but we're still requiring it.
Okay,
So the cat's now out of the bag.
I was just curious, because you wait for the bus and there's people that's not wearing them, and there's,
Well, the initial CDC and Homeland Security order required transit hubs inside and outside to require masks. In their latest adjustment to the order, which was, I think, a month ago, the only change was that outside areas at transit hubs did not require a mask. We have not changed our order. We're still requiring the masks.
Regarding that last point, I would think that we would be free to make our own rules that were a little more restrictive than what the minimum requirement is out there. So I'm glad you're doing that. I had a question. You look at all this money and you think, oh, well, heck, we could start our own demand response thing, buy a van or two and send them all over to provide people door-to-door service to wherever they wanted to go. But to what extent do we have to watch ourselves that we don't start a program that we can no longer afford when this pot of money is gone?
Well, that's the challenge with this money, is it's one-time money. And so you can stretch it over a couple years, but anything you start, you got to figure out how you're going to fund it in order to keep it going. And yes, we could buy equipment, and that I think is a fantastic idea. But an operating program is not something I would advise out of these one-time funds. Marianne and I have had a number of discussions about that, and that's her warning to the council regarding your pot of money as well. If it's a one-time cost, such as capital, great use. If it's an operating program or an expansion of what you're already doing that requires ongoing commitment financially, not a good idea. Okay, so the last page, by the way, I've not figured out how to lick my finger through my mask after all this time. So the last page of the exhibit is the one that I've replaced. Okay, so if you turn your attention to the one I just handed out. The top portion is just kind of an explanation of the biggest project we have pending currently, which is our VW bus grant. We have on order 7 buses. By the time we ordered them, the money was not sufficient to cover the entire cost. And so I've been back to the council a couple times looking for additional authorization. Well, the reality is that the money authorized is coming out of our reserve account. It's not an additional pot we found, it's coming out of the MetroRide reserve account. So as we roll money over, I'm trying to account for all the projects we have hanging out there and make sure that we've got enough money in our reserve account to cover it. And so I added a little additional that, if you look at bus inspection toward the top there, I had intended to send my maintenance supervisor out to do our bus line inspection, and he's announced his retirement instead. So I've got to hire that out. We are also finding, because of supply chain issues, that some of the options we would normally have added to our bus may not be available, and so we're having to choose alternatives which may not fit into the existing budget. So I've added $15,000 to our bus budget. So the bottom of this exhibit is the MetroRide fund balance. So at the top is where we started the beginning of the year. The second line is the carryover I'm estimating based on my budget. That gets us up to $1.4 million. And then the projects I'm listed below are, I'll just walk you through them. The phone system, the council already approved to come out of fund balance, so I'm just showing that. The VW bus grant, that's the number I had incorrect in your previous exhibit. I pulled the amount we're short and not the total amount. So that's $757,866. And so one of the things I want to point out about that line item is a part of that local share has to be repaid through reduced shared revenue payments over the next 10 years. So what I wanted to do is put it in here so that as we're shorted shared revenue payments over the next 10 years, we have a counterbalance in our reserve fund already. So I don't have to wring my hands from, how are we going to enhance our makeup money in our operating budget? It's in here. The door control replacement is in our 2022 CIP, so I'm just asking that we do it. Video system upgrade for our transit center, same thing. We want to go to digital video. The fueling system software, we are still running a DOS system for our fueling system, and we'd like to upgrade that so it integrates with our Windows 10 maintenance software. And then the other three projects, the fare box replacement, we were notified by WISTAT that they are awarding a separate grant to replace our fare boxes. Every year we submit capital projects that are kind of on our wish list, and they never get funded. Well, because there are alternative funds like the VW settlement and CARES money, transit systems don't have vehicles that they're looking to fund as much, and so they're trying to pick off some smaller projects. So I was very surprised to learn that they offered us money to replace fare boxes, but that's what that is. It's the local share of the project. So, depending on what the consultant team recommends, we may or may not do what I'm proposing or what I had proposed a few years ago when I put it in the capital plan. But, we'll budget for it. So that if we decide to do that, it's there. Service truck replacement, that's another project. They just said, we found money if you want to proceed with that project. And so I'm saying, well, why not? Let's get the local share in our reserve fund and account for that. And then we were notified by our tank inspector a number of weeks ago that we have to upgrade our tanks by the end of the year or they're going to shut us down, because there's been a DNR requirement kind of floating out there. They proposed it initially in 2014 and then just didn't move forward with it. And so we've been keeping our eye on it, at least so we thought, and then in the end it kind of caught us by surprise. So that line item I'm proposing would come out of our reserve fund, and that will be on the agenda for the Finance Committee on Tuesday. So that's my summary. In the end, it leaves us with a balance of just over $400,000.
On the service truck, we're not getting a truck for 8835. We're getting,
No.
that's the local share that's being covered?
That's the 20%.
Okay, thank you.
You're welcome.
Any other questions, or we'll move on? Okay, discussion and possible action on Metro Ride staffing.
I just wanted to kind of let you know where we are with staffing. At the previous meeting, I mentioned that we had 6 part-time bus operator positions that were vacant, 6 out of 9. That's 2/3 of our part-timers. We have really not been successful to date in filling those positions. So what we've done, we would normally have 2 buses on a number of our school tripper routes, our express routes, to manage the student loads, and we've not been able to double them. And so we've got some crowding. And I just wanted you to know about it in case, we get some complaints. Why aren't we doing something about it? Well, that's why. We are also not able to accommodate all of the off time that's being requested. And so, we're dealing with some morale issues, but, it kind of is what it is. Buses got to roll, we need X number of people, and so it's going to be a bigger challenge. My biggest concern from where I sit is the cold and flu season lies ahead, and all of those symptoms look an awful lot like COVID symptoms, and so between actually being sick and being tested and staying home, this is going to be a bigger problem. We are doing lawn signs and producing a video that should be out in the next couple of weeks here, and we're talking about doing a mobile job fair involving a bus. And so we've got ideas that are bouncing around, and we've put some into action, but it remains a struggle. We've also approached the union about opening the contract and having some discussions about what's possible. We don't renew this contract until mid-year next year, and we don't think it makes sense to wait. We're going to have to make some sort of adjustments. So we've initiated that process as well. So that's where we are.
You mentioned you were making job applications available on paper. Did that yield any benefit, or?
We've handed a few out. We have had a few interviews. We have one candidate in process. We made a hire, and he lasted a day. Not my cup of tea. At least we didn't spend a lot of time training. So, we've had a little bit of success, but so far we've only got, one candidate in process for the 6 positions. The other thing on staffing I wanted to mention is something I mentioned previously. It's our maintenance supervisor. He's announced his retirement December 22nd. That happens to be the day our buses go into production. So that'll be some big shoes to fill.
Greg, could you give us a little bit more insight about the one-day driver? I mean, did he have the CDL, or was he just, this was completely?
He had a CDL. He was fully licensed.
Okay.
Which is, I have to say, highly unusual that we get somebody walking in the door that has a passenger endorsement and an air brake certification. He had both. So we could put him to use. All we had to do is, train him how to drive this particular vehicle and show him where the routes go. And after a day, he decided it wasn't his cup of tea. And that's all he said. This just isn't my cup of tea.
Well, you may want to get back to him, and there's some DPW openings, and, maybe dealing with the public was not his thing.
Well, he was a school bus operator, so he's dealt with passengers before. There are some distinct differences. We don't know, but we suspect that the face mask may have been an issue. We know that Yellow Bus is not necessarily enforcing that, so, but ultimately, we really don't know.
So I wanted to raise, I understand that attracting new part-time drivers is an issue, and I guess I just want to make sure that we're focusing enough on keeping the drivers that we do have. So, I know we've got so much going on, and there's so much, you mentioned there are morale concerns because we can't grant time off requests, and it sounds like you're in touch with the union, but I guess I want to say that the best way to keep staffing problems from happening is to make sure that the people you have are happy. So I just, I guess I'm not asking you to do anything, but that is definitely a concern that's on my mind of, what are we doing to retain the ones we have so far? So you say, can you tell me more about like what so I hear you say that the union contract is up next year. Is there anything we can be doing in the meantime before that happens?
Well, the biggest challenge with our hiring is the fact that it's a part-time position. That's always been a difficult position to hire to. And it's part-time because the work is available during the school year only. And so what we've talked about is, considering the creation of a full-time seasonal position. That may work for some, may not work for others. We've talked about hiring at a higher point in the wage scale. We've talked about just hiring people as full-time. We've talked about a lot of different things. We are also in contact with the union on an ongoing basis. We have a labor management committee, and we're talking about all these issues. The challenge with, the biggest challenge with morale at this point is that, we're forcing overtime. We're having a hard time accommodating all the off time. We've been more liberal than our contract suggests we need to be for a while, and we can't afford to do that anymore. And so we're trying to enforce what the contract says, and it's been tough. But I'm with you. I would very much like to retain existing employees. I do know that based on what I hear through the grapevine, there are some retirements coming up. Bus operators, possibly a mechanic. And so, we're looking ahead and a little concerned, more than a little concerned, in fact. So that's why we wanted to have some discussions with the union now instead of waiting, because we know it's only going to get worse.
Greg, I don't know if you've talked to HR about this or if it's something that with the HR committee, but for some schools, you could end up getting your checks year-round, and then your health care, I guess, covered, and being an employee for 9 months. So is that something, has the city kind of considered something like that as a way to have the health insurance and then handle year-round paychecks? As I think they do that with the teachers' assistants and that as a way to have those funds available year-round so that they're not left without income during the summer.
Yeah, that was part of our discussion. We do rely on part-timers to do cleaning. We make 20 hours a week available in the summer so that we try to keep them busy so they don't walk away and not come back. Before we started doing that, that was a problem. And so we offer them things other than driving, and it's not everyone's cup of tea. And so trying to find a balance, not everybody wants to be swinging a mop in the summer. We hired them to drive. Some are in a position to take the summer off. They may be retired, and that's just fine with them. But the other issues that we've encountered, we're trying to be really flexible in order to attract people. And that flexibility means they got other stuff going on. And now that we're shorthanded, we can't rely on those people to be available for us because of that flexibility. They got other stuff going on. And so, one problem has kind of led to another as we've become more shorthanded. So, we thought we had gotten ahead of this when we negotiated the last contract 2 years ago. We dropped the first step of the pay scale, started hiring everyone at the second step, and we did that as a side letter before we ever renegotiated the contract. So then we baked it in when we redid the contract. So we thought we were ahead of the game. We immediately filled all vacant positions, and that lasted for about 6 months, and it's been kind of downhill ever since. So, I don't know. This is just kind of the latest in a saga of hiring difficulty that we've had.
Okay, so Greg, what do you have for the transit director's report?
Okay, so first I would like to say that department heads or agenda makers have been notified by the city attorney's office that action is not to be taken on communication items like reports. So I would lay that out there for you, which is why I reworded the agenda to say for communication only. Okay, so with that disclaimer, I did provide you a shuttle summary from the Outrageous shuttle we did in September. This is very different than either of the other two shuttles we've done, the Chalk Fest and the Hmong Festival, in that ridership was not nearly what it was for those other two events. We did a shuttle to the museum from downtown and a shuttle to Art in the Park from downtown. We didn't coordinate those so they could transfer back and forth. That wasn't the intent. It was just so that somebody could park downtown and then, oh, let's go to the park or let's go to the museum, and we would facilitate that. So it, again, was very different than the other two events. I provided the summary of those ridership in the gray shaded area to the right there, just to give you some perspective. For this event, we carried a total of 621 riders. So the end result wasn't nearly the same. I would also add that the fact that we have so many vacant positions and we're forcing overtime as it is makes it more and more difficult for us to take on these events. This one involved just a couple drivers each day, but this is after a day. This is 2 days after they had done their week's work, and so this was overtime. And so moving forward, unless we address, our driver shortage, we're going to have to think long and hard whether or not we're going to participate in this stuff. It just makes me uncomfortable from a morale standpoint, forcing drivers to work after they've got their work in for the week. And so I just thought I would lay that out there for you. Again, I'm not looking for action on that.
Any questions on that? If not, I'll take a motion to adjourn. We are done.
Make a motion to adjourn. I
Thank
gotta catch the bus.
Okay, yeah. Any second? Got a second from Peckham. All in favor, say aye. Aye, and we are adjourned. Thank you.